Good evening everybody. Today we will learn about circle of Willis. The circle of Willis is the blood supply of the brain. So we are having a two vertebral arteries is joined to form the basilar artery. Basilar artery will give rise to the terminal branch called posterior cerebral artery. These vertebral arteries is having a anterior spinal arteries. Two anterior spinal arteries joins to form a one anterior spinal artery, and the posteriorly there are two posterior spinal arteries. Okay, coming to the circle of Willis, we are having an internal carotid artery. This internal carotid artery giving rise to the posterior communicating artery and anterior cerebral artery. Two anterior cerebral arteries are joined by the anterior communicating artery. Posterior communicating artery will be joining the internal carotid artery with the posterior cerebral artery. Here the internal carotid artery will be continuing as a middle cerebral artery. The most important point of the circle of Willis is middle cerebral artery do not take part in circle of Willis. The clinical aspect of circle of Willis is the formation of a berry aneurysm. The berry aneurysm is the saccular aneurysm, is generally formed at the junction of the arteries of circle of Willis. The most common site is the junction of anterior communicating artery and anterior cerebral artery. The most common site of rupture of this berry aneurysm is the apex. If this is a rupture, then usually patients will have the intracranial hemorrhage, generally subarachnoid hemorrhage. So the middle cerebral artery not involved in the circle of Willis. The junction of anterior communicating artery and anterior cerebral artery is the most common site for the aneurysm formation. Site of rupture is the apex. Rupture of the aneurysm gives rise to the subarachnoid hemorrhage. Usually patient presents with that of the thunderclap headache, worst headache of the life, and neck stiffness, no focal neurological signs. Diagnosis is the non-contrast CT scan. CSF tap shows as xanthochromas. Xanthochromia is the blood degeneration in the CSF. Management is a coiling and clipping. So here we are having the anterior spinal arteries 1 and 2 posterior spinal arteries. These will be supplying the spinal cord. Posterior cerebral artery will be supplying the brainstem. Middle cerebral artery supplying the superolateral surface of the brain. Anterior cerebral artery will be supplying the medial surface of the brain.